Hi, and welcome to stress reduction and relaxation techniques using somatic yoga therapy. My name is Patty, and I'll be guiding you in the body observation tool today. And this particular body observation is a great tool to use to help you relax, feel more calm, more focused, more grounded in your body. Stress is something that we're all experiencing right now with the pandemic. Many people ask me, what is stress? Stress is a natural and normal part of our life. Stress is the body's reaction to any change that it has to make an adjustment or respond to. So, for example, here's the body, here's the pandemic. And we have to make some sort of change or respond to this pandemic. The pandemic is the change, and it's the response that we're really working on. And in that space, we get to choose how we want to respond. So oftentimes observing our body and taking a moment to just stop, take a breath, observe our body. We can oftentimes observe and then go ahead and proceed in a more conscious, more clear-headed manner. Then stress affects everyone differently. The body can react physically, feeling pain, and from anywhere from muscular skeletal pain, such as aches in the neck and the shoulders, to digestive or even palpitations in the circulatory system, the respiratory system. You can feel more, people can have more asthma attacks or just feeling digestive issues as well. So it affects all of us differently. And then mentally and emotionally, it affects us with more frustration or anger. Sometimes we can be more irritable at times. And so we worry. And this is all normal. These are all normal and natural reactions that we have while we're dealing with stress. So when it becomes overwhelming is when we want to use our tools to relax. And relaxation has been proven, scientific evidence to show that when we relax, we can really make our bodies work more efficiently. We can lower our blood pressure. We can lower our heart rate. We can even help make our lungs work more effectively. So with this virus, it directly affects the lung capacity. So by working with the breath and starting to pay attention to your breath is such a great way of tuning into your body. The breath is always going to tell you. So such as if you're watching a frightening movie, your breath will begin to speed up. If you all of a sudden someone tells you something horrific, we gasp. And so if we start to pay attention to the exhale as we're breathing out, we can start to relax and stimulate what's called the parasympathetic nervous system. So this is the part of the nervous system that helps us to relax, helps us, our bodies, to work more efficiently. So let's go ahead and begin with the practice with breathing. So just simply paying attention to your breath. The breath can anchor into the present moment. So if you take a moment to place your left hand over your heart and your right hand over your stomach or your abdomen, begin to just feel that contact of your hands against your body. Feel the body move as you breathe in and out. Notice the quality of the breath. As you breathe in, is it smooth or choppy, fast or slow? And as you breathe out, notice the same qualities, smooth or choppy, fast or slow, long or short. Notice if there's a pause after the inhale and a pause after the exhale. Taking your time to just notice and pay attention to your breathing in and breathing out. Is it easy or is it difficult? This is what is so important right now, to start to notice if the breath is easy flowing in and flowing out, much like the ocean, the waves in the ocean. Breathing in and breathing out. In diaphragmatic breathing, the diaphragm is a large muscle that is located right below your lungs. It actually helps to assist the lungs in getting air in and getting air out. So as you breathe in, it pushes down the diaphragm, expands the abdomen, and then as you breathe out, it comes back in towards the spine, pushing the lungs up and expelling the air out of your body. Using this breath to expand, breathing in, and contract, breathing out. Bringing the abdomen back towards the spine. Practice this as we begin to do the body observation. Doing diaphragmatic breathing can also help anyone with respiratory issues because you're assisting your lungs even a little bit more by paying attention to them. Breathing in and breathing out. And just continue that breathing as we move on. Moving on to beginning to notice your grounding. Grounding is where your body meets the earth or the floor or wherever you're sitting. So notice now for a moment just where you feel maybe the glutes, your gluteal area, the backs of your thighs or the backs of your legs. Whether either if you're lying on a bed or a couch, just notice where they touch that area. Contact the body where it contacts the surface. Notice where your hands, if your hands are touching your body where they are. You can also ground by an imaginary cord. I like to use this visualization because it helps me to be more rooted into the earth. Imagine a cord at the base of your spine extending all the ways down into the earth. Allow the body to settle deeper towards the earth. This helps you to feel more stable, more connected, and most importantly, more supported. So now you're grounded, connected to the earth, supported by your couch or your chair, or wherever you are, your mat. Connected to the center of the planet, breathing in and breathing out. Bring your attention now to all around your forehead. In the top of your skull and the back of your skull, around your eyes, your ears, your nose, your mouth. Notice any sensations as you breathe in. Noticing sensations in your head. Is your mind busy or quiet? Do your eyes feel tired or bright? Moving about, or are they still? Is your sense of smell keen? Or you don't smell anything at all? Is your mouth moist or dry? Tongue smooth or rough? Throat open? Are you able to hear clearly? Or do things sound muffled? As you breathe in, start to notice all of these sensations in and around your head. As you breathe out, letting go of any expectations what this body observation may do for you. And just noticing what comes up and letting it go. Watching it pass by. As you breathe out, begin to relax your forehead. Soften your eyes. Relax the jaw and the throat. All around the ears. And then just allow the jaw to go slack. And tell your brain to relax too. And then as you bring your attention down into the neck and the shoulders, start to notice any sensations around the front of the neck and the throat, and the back of the neck, the spine, around the shoulders, the shoulder blades. Noticing any tightness or looseness, any energy, weight. Do the shoulders feel heavy, weighted down, tight, open? Noticing the sensations as you breathe in, now from the left shoulder to the left fingertip. Noticing the upper arm, the elbow, the lower arm of the left arm, the wrists, the hands, and the fingertips. Noticing any sensations in the left arm from the shoulder to the fingertips. Maybe coolness of the fingertips or warmth. Is the palm dry or sweaty? And then bring your attention over to the right arm, from the right shoulder to the right fingertips. Noticing now the right upper arm, the right elbow, the right lower arm, wrist, hand, and fingertips. Again, noticing the temperature and the weight of the arm. And then as you breathe out, letting go of any tension around the neck, softening and relaxing the muscles in the neck and the throat. Soften and relax the back of the neck and the shoulders. Soften and relax the upper arms, the elbows, the lower arms, the wrists, both at the same time, the left and the right. To the fingertips, relaxing the whole hands and the fingertips. You can imagine channels just opening up throughout the arms, the shoulders down into the hands. And then bring your attention now into the chest area. Again, noticing the breath, the rise and fall of the chest. Noticing the lungs. Noticing if it feels easy to breathe in or easy to breathe out. Noticing any sensations around the lungs. Any heaviness or lightness. And then bring your attention over to the heart and begin to notice the heart and the outside of the heart, and then even imagining you're going inside the heart and the 4 chambers of the heart. And begin to just notice even the backside of the heart and the backside of the lungs. And then making your attention come to the upper back, between the shoulder blades, the spine, and between the shoulder blades is called the thoracic area. Notice that area. Notice any emotions in this area. Notice if there's any anger or irritability. Or what if there's a little bit of joy or happiness there too? Notice if the heart feels tender, vulnerable. How does your heart feel today? And then as you exhale, begin to soften and relax all around the rib cage. Soften the lungs and relax the heart. Relaxing and softening from the shoulders all the ways down the back of the upper back, the bottom of the rib cage. Softening. Imagine your back just melting into the mat, into the chair, or into the bed. Bringing your attention now down into the abdomen. From the bottom of the rib cage all the ways down into the pelvic floor, begin to soften. Noticing any sensations as you start to work down from the abdomen to the pelvic floor. Breathing in, noticing the expanding and contracting of the abdomen as you breathe out. Notice if the abdomen feels full or empty. Notice if it feels tender, heated, or cool, or crampy, or open. You might not notice any sensations at all, and that's okay. It's beginning to just bring your attention to the abdominal area and the pelvic area. Front side, internally. The side bodies, the left and the right side body, and then the lower back. Down into the hip area. Noticing sensations in the lower back of pushing or pulling, sometimes a gnawing. And again, notice any emotions. What are your thoughts? What are your feelings? And then as you exhale, begin to soften and relax the abdomen. Soften and relax the pelvic area. Soften and relax the side bodies. Begin to melt the lower back into wherever you're sitting. Or lying. Relaxing, breathing in and breathing out. Deeper and deeper. Relaxing. Softening. Letting go. Not judging. Just being here now. Now notice your left leg from your hip to your left toes. And pay attention to your right leg from your hip to your toes and your right leg. Notice any sensations in the hips. Again, noticing any tension, any congestion, or any openness, looseness, softness. Noticing the thighs, the knees, the lower leg, the ankles, and the feet simultaneously at the same time. Noticing any difference between the left leg and the right leg, or the right leg and the left leg. Noticing differences in heaviness or lightness, coolness, warmth, or notice also if there's any moisture in the bottom of the soles of the feet. The toes are cold. And then as you exhale, letting go of any tension in the hips, letting go of any discomfort in the legs, the knees, the ankles, or the feet, the toes. Relaxing the hips, letting the weight of the body settle towards the earth. And then just gently begin to bring your attention back up to your breathing, breathing in and breathing out. Stay here for a while, as long as you like. Noticing the sounds. Noticing any scents, smells. Maybe even noticing if you have any taste in your mouth. And then taking a moment just to listen. Listen to your heart. Listen to your breath. Listening to the truth. Breathing in and breathing out. Saying to yourself, I'm breathing in and I'm breathing out. And this concludes our session for today. Thank you very much for joining us. Namaste.